essentially, we're going to do a bit of a summary on what is menopause, how do we define it, what are the symptoms, how do we recognize them, how do we manage them, and generally supporting women at midlife and beyond. And a lot of the education that we have is around reproductive health. So we understand puberty, we understand pregnancy, there's a lot of support antenatally and postnatally, but we don't really think about women's physical and emotional health around 45 and above. So we call it the post-reproductive area. So currently everything's about reproduction. Women's worth is linked with that. Our entire existence is around being able to give birth, which is fine. There's lots of reasons for that. But we suddenly forget, and women become invisible when that reproductive life is coming to an end, which is essentially menopause. And how do we redefine that experience for women, which is obviously personal to a lot of women, but I'm going to look at a more scientific way and the biological mechanisms that impact women and why they feel the way they feel. So we're going to rethink menopause. And then with that, we'll go to the second slide, please, Laura. So let's start by basic definition. So there's a lot of terminology around what menopause is, but simply it's your last menstrual period or 12 months of not having any periods. And that's pretty straightforward. You miss your period for 12 months, and the average age is about 50 to 52, but there are a significant proportion who go through an early menopause, and that's the age between 40 and 45. And a lot of women will get dismissed when they come in with their symptoms because a lot of the doctors will say you're too young for this. So I think we just need to have a bit more open mind. There's a range of other definitions there. So obviously for surgical reasons, if you've had your ovaries removed, you'll go into what we call a surgical menopause, and there'll be immediately impacts of the symptoms physically, emotionally that will be present there. And there's other causes such as chemical menopause. A lot of women will go through any form of chemotherapy or radiotherapy. Post-cancer will go through a menopause as well. But I guess the one that we all don't have much research around is the perimenopause. And that's the one that's most turbulent. So the menopause is 12 months of no periods. And before you can get there, you have this fluctuating 5 to 8 years prior to that last menstrual period where the hormones are fluctuating, and with that you get a range of physical and emotional symptoms, and now they're listed to about 34 symptoms, and we'll go through them in the next slide that's going to be coming up. And there's very little research in this phase prior to the menopause, and the early symptoms that you'll experience will be menstrual changes. So I say to patients and women of all backgrounds, and I'll say to them, the first thing you need to start tracking is your menstrual cycle. And the flow can either become heavier, and flooding is very common, but it's also not uncommon for them to become quite light. And you might suddenly start having a 1 day or 2 day very light period instead of having a good 5 day period. You might notice a change in your cycle duration. So you might have a 7 to 6 day, and now it's a 3 day period, and that might elongate and prolong to about 5-7 days. There might be irregularity. So a lot of women will say, I had a really lovely regular 28 day, and now it's skipping or all over the place. And then finally, you might notice there's a change in the length of it. So it might be every 40 days or every 60 days. And these are all changes that are happening due to the hormones fluctuating or declining, which then translate into menstrual changes. Now, why that's important is that we normally think of our hormones just changing the menstrual cycle, but if you go to the next slide, the changes in these reproductive hormones that we associate with menstrual cycle actually have a direct impact on our mental, cognitive, physical, and other organs of the body. And the most common ones that we associate with menopause is the hot flushes, night sweats, and sleep disturbance, which are quite easily recognized. But in the perimenopause, when you have, I would say, adequate hormone levels, but they're fluctuating. So they're a bit low, you're still getting a menstrual cycle, maybe slight changes in it, but you're starting to notice these changes. A lot of women will say, I'm suddenly being anxious or feeling overwhelmed or getting crying spells or mood swings and irritability. And these things can either be cyclical around your menstrual cycle beforehand or during, or they can start having erratically throughout the whole month. The one that I find that impacts a lot of women's ability to be in the workplace is the cognitive symptoms. And there will be the word finding difficulty and the forgetfulness. And suddenly you'll be in the middle of a presentation and you'll find that you just can't find the word. And they can say, I can see the word, I can smell the word, but I just can't use the word. And they'll find that they'll start saying no to presentation and start avoiding I guess, situations where they need to be performing in front of other people, which again doesn't align with women at 45 to 55 when they're trying to achieve those career ambitions or at the peak of their careers. And I let you look at the list because it's obviously quite extensive and we can move on from that. So I guess the next question is, why does it matter? Why even bother managing the menopause? You know, it's a natural transition. Let's just put up with it. Well, the average duration is 7.5 to 8 years. So you have to do something about this, because if anyone is experiencing those symptoms, they're not just going to stop after 6 months and 12 months. So we need to have the awareness that these symptoms last 7 years. And in those 7 years, they have a direct impact on the woman's physical and emotional health, but also her ability to function at work, her ability to have a secure income stream. And the amount of women I see who have to give up their work or cut back. And if you're a single household income earner, single parent, there is a lot of poverty associated with that, where women are not able to have that financial security. So I think I'm not going to touch on that because I know Mary's going to talk about that, but all of these symptoms have that impact on them. And so the short-term goal is to eliminate those symptoms, or at least minimize them, so you can have quality of life and function in your personal and professional life. But we also need to look at what the long-term implications are. And I just realized this slide is about diagnosis. So this is a small summary about how you diagnose it. Well, it's normally a clinical diagnosis. So if you've had no period for 12 months, that's pretty easy. The perimenopause, again, would be all of those symptoms and changes in your menstrual cycle. But if you're someone who've had a hysterectomy or have a Mirena IUD or an endometrial ablation, these are all treatments that we use for heavy menstrual bleeding, then you might benefit from doing some basic hormone profile. But again, we don't recommend these if you're on the oral contraceptive pill because they're inaccurate. And then going to the next slide, which is what we were talking about, which is why does it matter? Well, if you were born in the Victorian times or about 50 years before that, the average life expectancy of a woman was 48, and you wouldn't actually survive to experience the menopause. And that's not the case now. So if you look at the birth rates for women born in 1891 onwards, the average life expectancy for women is 84.6. And that's about 30 years to 40 years post-menopause. So now we're spending this 3 to 4 decade post-menopause. And it's very important because the decline in hormones doesn't just have short-term implications on the woman's physical, emotional health, but we also have long-term implications on chronic illnesses. And if you go to the next slide, these hormones are very important for a woman's physical, emotional, but also organ health. So that's your brain health, heart health, and bone health. And when we're spending all this time post-menopause, we need to make sure that we're supporting women to support their long-term chronic disease prevention. And the main disease burden that we have in Australia, the main cause of death for women is Alzheimer's dementia, followed by heart disease, and a chronic disease burden is from osteoporotic hip fractures and diabetes and heart diseases again. So it goes back to where a lot of the focus is around women under 50, but this is the time, the midlife is a window of opportunity to optimize health because it's the predictor of your future health. And as an aging population with an increasing burden on already limited resource, in terms of healthcare needs and other needs, we need to manage this cohort and support them through more effective strategies. If I go to the next slide. So the question is, how do we manage this phase of life? So the treatment options, we all start with lifestyle, and they're basic things like nutrition, movement, and also managing stress and seeing your doctors for other healthy interventions such as stopping smoking, minimizing alcohol intake as well. But of course, if you're someone experiencing severe symptoms, then 30% of women will experience severe symptoms. Hormonal therapy is a gold standard and is safe and effective to manage this. But there's also lots of non-hormonal treatments which are effective in managing these symptoms, and there's complementary therapy such as cognitive behavioral therapy, and these are very effective at reducing symptoms, along with acupuncture and other things as well. So I think the first thing to know is there's lots of options. It's not just one thing, and knowing that some options work for some women and there are other options that are more effective for other women. And with anything, when we talk about healthy aging or longevity, in the next slide, it's always I guess, an overview of looking at all aspects of health. So in the next slide, I've summarized managing the midlife era, but also post midlife, so in your 60s and 70s, the fundamental pillars of good health and aging. You have to focus on sleep, alcohol minimization. MHT, which is menopause hormone therapy, may or may not be part of your kind of tool in the kit, but you still have all these other things that you can focus on. And social connection, we know with meaningful social connection in the right community is very essential for us in midlife to navigate this time menopause, which we can feel very isolated. And there's isolation because when we experience these symptoms, because there's no open conversations about it, there's a lot of shame. And whenever we don't talk about something, there is shame, and then we think it's just us experiencing this. So I think there's a lot of awareness now around midlife, and there's lots of communities that are emerging where women can communicate and discuss their concerns and their experiences. But it's just about sharing those experiences will make this phase a lot more easier to navigate. And then finally, thank you again, Victorian Women's Health Services and Laura, for inviting me today to be part of your panel discussion. I have on social media, I created a platform which is purely educational. It's all evidence-based information, and it's a well-rounded holistic approach to addressing all the non-hormonal, complementary and hormonal therapies. And this is for women that they can take this knowledge and take it to their healthcare professionals, because of obviously everyone can't always access my services, but there's no reason why they can't take this easily accessible information to their own healthcare professionals. Thank you again.
Thank you so much, Dr. Fatima Khan. I think that was incredibly informative for our participants. For those of you who may have questions that you would like Fatima or our other speakers to answer at the end of the presentations, I'd invite you to use the Q&A function in Zoom to submit a question, and we will try to respond to as many of them as possible. Our next speaker is Mary Crooks. Mary Crooks is the Executive Director of the Victorian Women's Trust, a role that she has held for 26 years, following an impressive career in public policy and community engagement, spanning youth health, unemployment, and the environment. For her distinguished services, Mary Crooks has been appointed an Officer of the Order of Australia, was the inaugural recipient of the Vida Goldstein Award, and has also received the Centenary of Federation Medal. Mary Crooks will be speaking on the impact of menopause on women's participation in the workforce and her work through the Victorian Women's Trust to advocate for and implement menstrual health policies at work. Please make her welcome. Mary, do you, I might just stop screen sharing.
Okay. We're all set to go. Thanks, Laura. And what a superb overview, Fatima, that you've given this webinar. I wish we had met years ago, to be honest. So it's great to meet and see your work today. I'd like to take, for my portion this morning, a quick romp through some of the important research that we conducted and tell you about the work we've been doing around menopause and menstrual leave. So our work began in earnest in 2014 when we started to research what ultimately became the publication in 2019 called About Bloody Time. And we started that research by a huge survey of some 3,500 women, mainly from Australia, but certainly some internationally, and across all age groups. And that research showed a number of important findings, which I'll just quickly establish today. How did people feel about their periods? Mainly 40% felt mostly bad about their periods. Did they know what was happening when they started to menstruate? A third had no idea or were uncertain. Their information sources that they relied on for their knowledge about the cycle, usually from their mother, from school, 56%, mother 70%, friends 38%, books 22%. Were they happy about reaching menopause? No, about a quarter disliked it intensely. Were they prepared for menopause? No, 46% said unprepared. What was the source of their information about menopause? It was mainly from friends, doctors, the internet and TV. So I'm sure it'd be terribly reliable if it was from the internet and TV. What would make for a better transition to menopause? Reliable information, 36%. Time off, 26%. To be able to speak openly about it, 25%. Not making excuses, 21%. What would make for their experience of menstruation generally to be a better experience through their life? Time to rest, 58%. To have cheaper menstrual products, 37%. Not making excuses, 35%. To be able to talk openly, 30%. To be able to ask for employer support, 24%. So they were our broad findings. And then I might say that in 2021, some years later, we partnered up with a group called Circle In, which provides support for parents in the workplace. They conducted a survey around menopause, and their key findings in terms of the impact on working life were huge. 83% of respondents said their work was negatively affected by menopause. Over half, 58%, said that managing work during menopause was challenging. About half of all respondents struggled with a drop in confidence at work, and almost as many felt stressed by having to hide their experience. 30% said they felt disconnected or distracted from their workplace during menopause. Almost half said they had considered retiring or taking a break from work from when their symptoms of menopause were severe, but 72% didn't go through with it, I think understandably, because they were citing financial concerns. Half of those that know something going through menopause said their knowledge was low or non-existent. They hadn't had the benefit, for example, of Fatima's knowledge that we've had today. 76% that had experienced menopause would have liked information, advice, or access to a support network at work. Only 3% of respondents felt they had received excellent support at work. 60% said support was poor or below average. And 70% of those who'd experienced menopause did not feel comfortable talking to their manager about their needs. So can I just ask is the background noise, is that coming through? Laura? No, okay.
No, you're fine, Mary. Thank you.
It's got, there's a very happy staff outside my door. They're making it very clear that they're happy. So they were the broad results. So clearly we had a problem around stigma, around taboo, around women being expected to soldier on, to pretend that all was well with the world, when in fact the impacts were quite significant. Fatima has outlined them, and the impacts are having adverse effects, mostly on the quality of a woman's life in and beyond the home. Before we published About Bloody Time in 2019, and as a result of this research we had done, we thought it was an absolute no-brainer at the Women's Trust to develop our menstrual leave policy, our menstrual policy. And so we introduced this in 2017, and I think it appears that we were pretty much the first Australian organisation to do so back then in 2017. So we adopted a menstrual policy which has 3 provisions. First, if you are at work and you are feeling poorly, you're cramping, you're feeling uncomfortable or whatever, then you have permission to move around in your workplace to find a point of comfort. So it might mean that you go and take a walk in the fresh air. It might mean that you can stretch out on a couch with your laptop. It might mean that you can spend, or maybe even have a standing desk and so on. So it was all about finding comfort in your workplace and being able to talk openly about that. But the second part of our menstrual leave policy is that if you woke up one morning and you felt absolutely crappy with cramps, discomfort, headache, whatever, but if you felt you could nonetheless be a productive worker that day, then you were entitled to be able to work from home, and your working from home policy would kick in from the employer. But if, however, you felt when you woke up that you were just unable to be a productive person that day, that it was just going to be too stressful, the whole idea of working or going into your office or whatever, then you were entitled to up to 12 days of paid menstrual leave per year. And that menstrual leave did not require a doctor's certificate because for 2 reasons. One, we didn't think that people should have to go and make a doctor's appointment and go and get a certificate. But more importantly, we opted for the simplicity that why should you need a doctor's certificate to have a day of menstrual leave? Because it's not an illness. That was our starting assumption. Now, I might add that over the course of the last 5 years of having this menstrual policy, which is also abetted by having free menstrual products in our bathroom for people. But over the course of the 5 years we've had this policy at work, we're up to about 37 days of paid leave have been taken across our office. Now, it's a small office, 12 people. There are 2 men on the staff. So 36 to 37 days of paid leave averages out over that time to about 6 days a year. So some women may take 3, 4, 5 days a year. Others might take 7. Sometimes people take none. So it's not, the sky didn't fall in. The sky didn't fall in by having people abusing the system and whatever. In fact, I have said to some people I've been working with this year that if they put in an enterprise bargain agreement or something, for example, up to 6 days of menstrual leave a year, that probably would be sufficient in my view. So we've been learning on the go. We then published in 2021, last year, we published, and it's available free of charge on our website for you, a document called Ourselves at Work, which is a practical guide to help employers, to help managers, and to help people in their workplaces to start developing a more open and a more positive menstrual culture in their paid workplace, and a guide to being able to take the sort of steps, do a workplace audit, check on the temperature, check on the office arrangements, check on your working from home policy, how to develop a set of leave provisions. So it's all there in Ourselves at Work. So let me just end my part by saying that ever since 2017, the hunger and the appetite for developing menstrual culture across workplaces is strong, and it's exciting. Change is afoot. And I think probably in another decade or so, we will look back and think how weird was it that up until now, that there was so much hesitation to forge ahead with this idea of smashing the menstrual taboo right out of the park, and to enable women to do what is important, as Fatima outlined in her talk. Self-care is so important. And when people are oppressed by a menstrual shame and a menstrual stigma and a lack of knowledge, it mitigates against their own agency to be self-caring and to look after themselves as much as possible. It's a thrilling change that's underway. We have been running sessions, for example, with women in the public service. We've been running sessions with men who are leading education unions in other states and territories. So there's been a very, very diverse range of applications where people are already taking up now the challenge of developing positive culture around menstruation and menopause at work. And my final point, Laura, would be that in some respects, the menstrual stigma, as long as that exists, it's one of the pieces in the gender equality jigsaw that we're not putting into the right shape. Because if people are feeling oppressed, if people are feeling shamed about their bodies, if they're not talking to their partners, if they're not talking to their children, if they're trying to soldier on with a lack of support, if they're being silenced in a way about important parts of their life cycle, then that's holding us back in terms of achieving an equality and an access to opportunities and resources. A woman, through her cycle, through reaching menopause, should not be being penalised in her paid workplace. She should be respected for her talent and her capacity and her experience. So I think it's one of the last big pieces of the gender equality jigsaw, apart from those more obvious structural issues, such as a gender pay gap and through sexual harassment in workplaces and so on, and equal representation. The notion of being able to operate within a positive menstrual culture, I think, is a precondition of a truly equal world. So, Laura, thank you for the fine planning and support you've put into planning the webinar today. I'll hand it back to you.
Mary, thank you so much. I'm sure all of the participants are as inspired as I am. I completely agree that addressing menstrual leave and the impact of menstruation and menopause on women, including in the workforce, is absolutely critical to gender equality. Our final panelist for today, before we move into the question and answer portion of the webinar, is Jodie Bellier. Jodie Bellier is the founder and managing director of the Women's Spirit Project, a volunteer-led initiative that aims to inspire and empower women facing adversities through fitness, health and wellbeing activities, and through building connections with other local women. Jodie Bellier established the Women's Spirit Project in recognition of issues facing women in the Bayside Peninsula region in Victoria, such as social isolation, family violence, mental illness, psychological distress, unemployment, and poverty. In this role, she utilises a wealth of experience of working across the community, government, corporate, and philanthropic sectors for over 25 years. Jodie will be speaking about her lived experience of navigating the challenges of menopause, including the healthcare system and its impacts on her life. Please make her welcome.
Thanks, Laura. And first of all, I'd like to acknowledge the work that Laura's put into coordinating today and WISE. I'm very excited to be here today because I've been nagging Kit and a number of members from WISE that we need something on this topic, and here we are finally, which is very exciting. I'd also like to acknowledge and feel very honoured to be speaking alongside Fatima today and Mary. What incredible work both of you are doing, and great to be in the space with you both. And I'd also like to acknowledge the traditional owners of the land, the Bunurong and Boonwurrung people of the Kulin Nation, and pay, oh, there goes my phone. Of course it goes right now, doesn't it? Sorry, everyone. I'd start that again. I'd like to acknowledge the traditional owners of the land, the Bunurong and Boonwurrung people of the Kulin Nation, and pay our collective respects to elders past, present, and emerging, and acknowledge that sovereignty has never been ceded. I'm going to talk about my lived experience over the last 8 years, and it's been a journey, and I just want to acknowledge that everyone's journey is different, and this is my story, and that what I've experienced will be different and similar to some of you. So my journey started in about 8 years ago in my late 40s. I was starting to experience sleepless nights, a bit of insomnia, feeling a bit more moody, emotional, tired, particularly feeling it because I love to remain fit, healthy and well. So the energy that I needed to keep doing what I do was starting to wane. So I went to the doctor, and knowing a little bit about menopause through my mum, but not a lot, I thought, right, I need to start digging around here and seeing what I can do just to see whether menopause was a reality. So I did nudge my GP, who was a bloke, and he tested my hormones. Now, I do hear that people say, oh, that's not going to tell you anything. Well, I asked him to start testing my hormones for every 6 months or so for a number of years, and he did start to see drops in my estrogen and progesterone, and was able to actually pinpoint the year and month when I would be in full flight menopause. So, so part of that required me to be tenacious and persistent in finding out what was going on. And I suppose that's probably one of the key messages for me. Don't stop trying to find a solution, and keep nudging your doctors. And if your doctor's not giving you what you need, you then need to go and find someone else that might. And Fatima's here today, so she's given me some great links. So one of the things I did to start, I've always been a devotee of natural therapy. So I went to my naturopath, and we started looking at some alternative therapies, over-the-counter options like, Promensul and things like Happy Hormones worked for me, and they worked for me for about 2 to 3 years, and then they stopped working. And then I went, I believe, into full flight menopause when my period stopped, and the things that I had been taking no longer worked for me. So I was having my insomnia increased incredibly, my hot flushes, my peaks in emotion, my dips, and also rage. It'd be like this rage would just come through my body, and it would last maybe for 10 or 15 minutes. And I'm like, what's wrong with me? So there was these different behaviors that I was experiencing, and I didn't want to go down the hormone path of HRT because of the fact that it had such bad press. But I got to the point where I was like, no, I need to. My mental health's really suffering here, and my relationship with my husband and my son. So Western medicine, I embraced Western medicine, and initially I used a product called Duavive, which was coming from the United States, and that worked for me for a while. But then COVID hit, and what happened was the supply chain fell apart. And so I went, all right, surely menopause has finished and I'm through this. And so I went cold turkey without any Duavive because I thought I'd be right. Well, I wasn't right, but this time I could really acknowledge the signs and symptoms I was experiencing. And I was able to call it out and have a conversation with my husband and son and say, you're going to have to bear with me because I've got to find a solution, and it's not going to be overnight. It was at this point that Dr. Sandy Vincent-Bromberger, who is a doctor that treated both my grandmother and my mum over the years for different women's health issues, I was like, right, Dr. Sandy, I've got to go and pay you a visit. Now, she's very popular, so it did take me a bit of time to get and see her. So as an interim measure, I went on some patches from the doctors. But what happened there was too much estrogen in them for me. So I got my period for the first time in 2.5 years and had a period for 3 weeks. So, there's different things happen to women's body, and it really taught me a lot about hormones and the impact of hormones on our bodies, on our physiology, on our mental health. So it was really interesting. The human body is an amazing thing, is one of the things that came out of my little journey there. So Dr. Sandy is very, very thorough. And so my appointment with her required me, there was a number of appointments doing some really significant blood tests, I had a bone density test. She did a really clear overview of what I was eating, how much I was drinking, how much sugar I'm taking in. So it was a real holistic approach to my health, which is what I love. And so I've been seeing Sandy for the last couple of years, and I'm really excited to say that I am where I was 2 years ago and where I am today is incredibly different. I couldn't do the work I do with other women, which involves fitness, health, and wellbeing, without having the support that I've got from Sandy, and also advocating a range of things that she does. The importance of diet. Like, I know if I have too much alcohol or too much sugar, I know my insomnia is going to be up. I'm going to have really restless legs, and the signs and symptoms of menopause are going to be elevated, and then that impacts my well-being and how I go about my life. So there's practical things. I have gotten over my apprehension about using HRT, and Sandy produces bioidentical crochets, which are manufactured or produced by a compounding pharmacy that reflect what your needs are as an individual, and they work for me. And I know there's lots of other options for women. So I've got a lot to be thankful for, but it's been a journey. And I think there's some things that I would really advocate as a woman with lived experience around this. Your journey is going to be your personal journey. I have been relentless in talking about this with other women my age, asking about their experiences, or because of my work, I have women talking to me a lot about what they're dealing with. And what they're dealing with, and I say to them, have you spoken to your doctor about menopause? And more often than not, these women will say no, or the doctor hasn't put it out there as a possibility. So, the more we talk about this experience as women, the more with other women, we're creating awareness and understanding. And we also need to talk about it with our partners. There was an SBS Insight episode 30 that was aired in 2020. That is, I advocate that everyone watch that Insight episode with their husbands or partners, because it's got a range of doctors and women with lived experience of menopause talking about their own experience. And it's really, really insightful and educative. And husbands need to watch it with their wives, because it helps men understand what menopause is all about, because it does impact your relationships. I'm really clear. My sexual interest, dropped off the cliff, and it's back there somewhere in the 10 years ago. And these are some of the things that do happen. And often you either don't know or we don't talk about it with our partners, and we need to. Because it's about managing expectations, both our own expectations of self and what we're capable of, as Mary's talked about, the expectations of employers. But it's also about the expectations of those we've got a relationship with. I'm an older mum with a 16-year-old son, and all of a sudden his mum's having a bit of a rage, being able to explain it to him, mate, this is where I am. This is what happens for women in their, late 40s, 50s. I'm really sorry. You're going to have to bear with me. So the more we talk about this and experience as women, a rite of passage into maturity and wisdom is how I see it, the more people can understand the journey. So aside from talk about my own lived experience and advocating that all of us women should be educating ourselves and talking to others about it, there is definitely work that needs to happen at a systems level, both with policy, research, awareness raising and advocacy. And I suppose that's why we're here today. It's unscrewing the lid, lifting the lid, and shining the light on what is a really important topic that impacts women, so many women. And yeah, I think that's about all I can say. other than just keep chipping away at finding a solution, because they are there, and looking after yourself as best you can. So thanks.
Jodie, thank you so much for generously sharing your personal experience with menopause and the work that you've done to advocate in both your personal and professional spheres around menopause. We're going to go into the Q&A portion of the webinar now.